Oh, sorry for the face. My computer was saying you're not live while the timer had started, and I was very confused. And what I'm feeling shows on my face. Hi, it's Kim. Welcome. I think I have lipstick on my teeth. Welcome to the live stream. This is Kim. I can't see well enough to see if I have something on my face. Hold on. No, that's just my teeth. All right. So I am here coming to you a little disjointedly, apparently, from California today. You might notice I have sideswept my bangs today. Why have I sideswept my bangs? I'm thinking about doing kind of a sideswept bang for the summer. Do I think it looks as good? No. Do I find it, one, a lot easier when it's sweaty? Yes. Do I also find it easier because my hormones are completely out of whack and my hair got thin again? And so it looks thicker when it's gathered together than when it's spread out. It is an optical illusion kind of a thing. Anyway, so we're going to be trying this out for a little while. Speaking of hormones, I can talk a little bit about that. By the way, hello, I am Kim Howerton. I am a little chaotic. I am a health and lifestyle and nutrition coach coming to you from California. I talk about all things health related. I've got a book coming out in the late summer with Dr. Ken Berry about blood labs. And I've got some exciting things on the horizon. I will tell you that blood labs were definitely something that I was talking about today, because I had a meeting with an online provider for hormonal support for my perimenopausal issues. So that was exciting. And I warned her up front. I was like, I am a health coach who knows a lot about blood labs. So I will ask questions that most people won't ask. And, I just kind of gave her that heads up. And she kept saying, I say this to everybody. I know you understand it, but I have to say this or else I don't know what it's fine. It's fine. I'm trying not to be annoying. It was good. We had a good rapport. And so definitely I will be starting on estrogen and progesterone this week. I'll be doing a transdermal patch to start with. And I will be doing some progesterone micronized because hold on, I gotta block somebody. And I will be doing that, and then I'll be starting on some testosterone as well, because all three are in the toilet. So that's what's going on with me and my experience with hormones. So I will definitely be reporting on my experience with this. I know that this is something that people in my audience have said that they're interested in hearing more about and learning about. And so I'm using MIDI, MIDI, which is a online provider. They have actual doctors. It's not I don't know what to call it. It's not like a med spa. It's a actual online provider of care. I spoke with a nurse practitioner today. It looks like what they probably do is they have a nurse practitioner meet with you. They can prescribe stuff. They can do all the stuff, but they consult with an OBGYN about anything advanced or significant and go over blood work with them. And so it's like seeing a regular doctor. They just don't do the physical stuff. So you still need a local doctor for the physical stuff. But for those of you that are in perimenopause or menopause and are struggling to find a provider that, like, your doctor is not on board with what you want to evaluate or work on hormonally, my experience with MIDI has been really good. So that's a recommend. That's, I wanted to be able to provide feedback. Interestingly, my doctor will also do these things, But I wanted to, I have a OBGYN who's like, if you need hormones, just let me know. Here's the thing. My OBGYN it takes forever to get in unless it's like a scheduled thing. And I was like, I want to find out about these online services, how they work, what's going on, so I can talk about it. Because a lot of you have this need. And so I was like, look, I can wait 6 months to get into my provider, or I can schedule this meeting and work on this. And this is my second meeting. And so that's what I'm doing to kind of test drive the service and see what people might want information on. And she did. I will say that the provider, Julie, was the woman I talked to. She was saying every state has different laws about testosterone because for idiotic reasons, mostly, I guess, for sports issues. I don't know. Testosterone is considered a controlled substance, so it has more strict prescribing guidelines around it. And so even though MIDI operates, I think, in every state, their rules around prescribing testosterone actually can vary from state to state. So that's one thing that I seem to have found out. So I have thoughts and feelings about that being stupid, but I got lucky that I'm in a state that they have to have a doctor within your state prescribe you testosterone. At least that's the rule here in California. And so MIDI does have Californian doctors. And so they have other states too, but they did have a doctor that's of a level. I guess a nurse practitioner can't prescribe. This is a guess but like a certain level of doctor can, and with certain, coverages. So anyway, so that in MIDI is apparently state by state, but she seemed really up on, the things I wanted my provider to know about. She knew about those things. We talked about, thoughts and feelings and, what she thought about this and that. We were pretty aligned on, not on everything, but, for what I needed, we were aligned. And so that was a good experience. So far I can thumbs up the MIDI experience on that. I had recent labs, so we went over those together. If I didn't have them, she would have ordered them for me. My insurance covers their clinic. So I can't guarantee everyone's insurance will be covered, but they do take insurance. And so what they order, what they do can be within insurance coverage. So far, I'm pleased with the experience. She wanted me to start on, they prefer dermal, so either a patch or a cream for estrogen, which I agree with. The micronized progesterone, which I agree with. We talked about even vaginal estrogen options and, what they are, and she walked me through. And so, across the board, everything was really great. So anyway, that was my quick review of my experience with MIDI. I will say that I met with them a couple months ago initially, and I came out of it thinking, that wasn't super helpful. My symptoms were less than, I was less menopausal and I had fewer symptoms. And at that point, that nurse practitioner had said, well, maybe the birth control pill, let's put you on that and see what happens there. Wasn't super happy with that response. I didn't push back very hard though. And came back this time and said that I don't think that's the right option. I actually think I need hormones. Here's why. The practitioner was super receptive to that. And I came out of that with a prescription when I could show her the labs, could explain why I thought that was important. And she also talked to me about other screenings. She gave me a referral to a doctor about some iron issues. She gave me information about some breast cancer research that had been done in the last year. So, she was very helpful. And we only had a 15-minute. Now, I'd only scheduled a 15-minute consult. At the end of 15 minutes, she's like, we're not done. Are you free later today? She called me to finish out what we needed to talk about. So all in all, I am super happy with my experience. Does anyone have any questions? I'm happy to answer questions. I'm just kind of giving you an overview. I have banned one person so far from the the live just for being weird. So there you go. But I don't think most of you are weird, unless you are obsessed with rubber gloves, as this person was. Anyway, hey Nancy, thanks so much. Did you get Nancy? By the way, I won't talk about what I said because I don't want to. It's a live stream, but I messaged you today, so hopefully you got that message. Thank you, Nancy. I appreciate the haircut. I was saying when I first got on that I have the swept bangs today. It's cooler and many other reasons, but yeah. So anybody, if they have questions, if you want me to talk more about the menopausal experience, if you want me to talk more about the MIDI experience, if you want me to talk more about the symptoms I've been having, like I am an open book here. I'll try not to be graphic, but I will be honest. So, okay, great. Super Nancy. Excellent. Thumbs up. Yeah, I just got back. Well, not just. Time is relative. I got back a week ago. I got back Tuesday night from Tennessee. I spent a week in Tennessee with Ken and Nisha Berry because Ken and I are finishing up our Common Sense Labs book, which will be out in late August. And it was our kind of last pass, making sure we agreed with everything the way it was. And so we did that together in person. It went really well. I had some wonderful meals with Nisha. I hung out with the babies, and we all have very unique relationships. I am Aunt Kimmy to the older Beckett, and I am Sister Kimmy to the younger Bonnie. But all is well with that. I will provide multiple roles, just depending on what they need. They were hilarious and energetic and gorgeous children. And I mean, that would sum up Ken and Nisha Berry as well, right? And had a good time, got a lot done, spent some time in stormy, yet sunny, yet beautiful, yet stormy Tennessee this time of year, apparently. And so, yeah, so that was my experience. Enjoyed it. A lot of work. I didn't get as much time to hang out and cook with Nisha, so we're going to have to reschedule a visit to do that. Nancy asked, am I going on the low carb cruise to Alaska? No, I'm not. I sent some books, so there should be a few giveaways of that. But one, Alaska is cold. I don't do cold vacations if I can avoid it. And two, I don't love a cruise anymore. It's just not my main thing. So no, I won't be going on that, but I totally support the endeavor. I hope people have a wonderful time. I know some people just get really excited about Alaska, so I'm sure that's going to be super fun for people. So yeah, but I will send my warm regards and love. Unfortunately, not my body will be there. I don't know what the next event I will be at. It will probably be, I think I'm going to go to the Tennessee event in Dixon in September. So that's in Tennessee. I think it's called Low Carb for Better Health. I think that's what it's called. I will be, so I don't think I'm going to be speaking, but we might be doing some fun things in and around that event. So I will leave it at that until we have more of an announcement to make. And what else is happening this summer? It is June already, which is summer to me, right? Summer follows the school season to me, although the school season is different than it used to be. Do you guys remember when we were kids? I say like we're all the same age, but when I was a child, summer went at least like June through late August, but now it's really more just June and July. Although it's hotter than the hinges in August, but a lot of kids are back in school by early August. So that is unfortunate in my mind, but I understand, and I'm sure the parents like it. Although I would rather be off July, August. But I'm in the part of California where we really get our summer in August, September, our summer weather. And so it was always like time to go back to school right as it got hot, and it was cold in June. And so it wasn't the best, but it was what it was. Anyway, if anybody has any other questions, I'm happy to answer them. I have made for dinner, we're having a little chicken stir fry. It's half done. It'll get done after this call. And yeah, that's what's happening over here. So any questions, I'm happy to answer them. If not, we'll wrap it up for the day, and I'll just go with this was a call mostly about my update about my hormones, which I know not all of you are interested in, but enough of you have said that you're interested, so I said I would talk about it. So, all right, guys, I will be back next week to check in if things seem good to do so, and see you later. Oh, wait, Jerry had a question. Jerry Lynn, after menopause and a total hysterectomy for endometrial cancer, losing weight is almost impossible. Any suggestions? So, does menopause impact hormonal things that might cause weight loss to be more challenging? For sure. For sure. It shouldn't make it impossible. I don't know what you've done so far, but don't lose hope. Weight loss is possible with the appropriate effort and approach applied. It's often just about finding the approach that works for your body in the state it is in. Also, I don't know if you've discussed the option of hormone therapy. I don't know what the contraindications are for endometrial cancer in terms of those. So that's something that, obviously could be discussed with a doctor. But even if you're not applying any of those things, weight loss is possible after menopause. So, how much do sex hormones have an impact on our ability to lose weight? On a large scale, it's absolutely still possible to lose weight. It might be a lowered metabolic rate can happen, but a lot of times, so it's not a direct link. So what really will often happen in a menopausal woman is the lowered hormones cause changes in body composition. So it causes some muscle loss, and then that muscle loss causes difficulty losing weight, right? So it's not A to B, it's not A to C, it's A to B to C. So what most people need to do to keep the weight loss easier in menopause is to work on that step B, that muscle mass, which it's harder to put on muscle mass after those hormones have declined, but it's not impossible. So a lot of that hormonal transition in menopause is about muscle gain, is about strength training. And with that increased strength training and some changes in diet to make sure you're supporting that growth of muscle mass, then you can counter some of the effects. I don't know, I'm doing a lot of interpretive dance with my hands, but you can counter the effects of some of that change in hormones that can sort of lead to a change in body composition. Low carb spin asks, how long does it take to see an improvement on estradiol patch and progesterone? So I can tell you, like what my doctor and I talked about today. I keep saying that, but my provider and I talked about today was she's going to start me on a low dose, and we're going to see how that is. 6 weeks later, we're going to reevaluate. So she was indicating, and this is my research indicates as well, that you probably want to check in and you want to see some improvement every 4 to 6 weeks on hormones. Metabolic markers, different markers, different things, but in terms of symptoms and even hormone levels in your blood, 6 weeks should be enough time to see improvement or not enough improvement. And then you can make a call if you need to bump it up, bump it down, bump it sideways, I don't know, bump it diagonally, what you need to do differently. The other thing to always realize in terms of anything absorbed through the skin is there is a good amount of variation in how much is actually getting into your bloodstream. So thicker skin, more collagen, like there's all sorts of variables that affect how much you're absorbing. And so you kind of have to, it doesn't matter how much you put on the skin, it matters how much gets through the skin. And so that's why you need to monitor that, either like symptomology, blood labs, both, because there is actually some significant data out there that it's not a one for one. It's not like I give you this much, you get this much. It's variable. Some people are better absorbers, so a lower dose, they absorb it all, they get a higher dose. Some people are low absorbers, so you got to give them more so they absorb a normal amount. And so that's something that you've got to take into account with the dosing. And you only know that experientially. That's the word I was trying to say, right? You only know that over time by trying, checking, and seeing. But yeah, I've seen there's a lot of data coming out very recently, because transdermal is, you have to absorb it through your skin. It's not being like poked through your skin. So that's something. I still prefer it as a method, and most people would, because if you ingest estrogen, if you take oral estrogen, it's got to get digested. It's got to go to your liver. It's going to have impact on clotting factors within your liver, potentially. It increases certain health risks. I'm not down for those, unless they were my only option, maybe. And so there are lots of benefits to something going through the skin. Have I heard about high cholesterol being a menopausal symptom? It is absolutely. It is absolutely your cholesterol. So the change in hormones will impact your cholesterol, and it's impacting mine. Even I had I had an NMR recently, which is a looking at the particle size, and I'd had one previously, and it's now, so even though my total cholesterol went up a little bit, but the pattern got more atherogenic, as they call it, right? It went a little, like I used to be all like large, buoyant, fluffy. Now I'm getting a few more small is starting to increase that, so total cholesterol going up, changes in cholesterol distribution, changes in insulin, fasting insulin resistance. Those are all menopausal issues. Not exclusively, right? But during menopause, those all can change for the worse. Rita, do I have an idea to get my cholesterol down? All right, Rita, I'll come back to that, but just back to low carb spin here. So all these things, right? Like all hormones can affect cholesterol levels. So also thyroid levels. If you have hypothyroidism, that can cause high cholesterol. If you have abnormal sex hormones, that can cause it. So it's not just one thing, it's lots of things. Anyway, Rita, so ways to reduce cholesterol. First there's a question of what, do you have cholesterol that needs to be reduced? But if you feel like you do, then, some of the things to look at would be, you can look at changing, and so you have both cholesterol issues and diabetes issues. So that impacts what we might do. So, and by we, I mean you. And again, this is not medical advice. I am not a doctor. Please take everything I say with a non-doctor grain of salt. So if it's important to you to get your cholesterol down, because, the diabetes numbers obviously make sense. And if the cholesterol is important to you as well, again, I am a coach. My job is to help people with their goals, not give them my goals, right? I can't be like, don't worry about that, because that's not my body and not my life. But if you're like, how do I do this? I'm like, well, I can talk to you about how to do it. One of the things that you could look at would be more of a potential higher vegetable keto approach. There is some effect of more of a higher fiber keto diet, which for somebody with like gastrointestinal issues, I'd be like, well, but if you're like, hey, I need to do this, there is some fiber LDL interaction that can have a lowering effect there. So, you might want to look at something along the lines of there's a book that's like high fiber keto. You can run an experiment. How do you do on that? Some people find high fiber foods don't raise their glucose. Some people do. So that's going to be a one-on-one kind of issue. You also have hyperthyroidism. So, you got some stuff going on there. So deal with a hyperthyroidism. That's going to be medication, doctor involved basis. In terms of the diabetes, changing the way that you eat to try and bring those things down. And what does that mean about changing the way you eat? No highly refined foods, no high sugar carbohydrates, not a lot of carbohydrates that aren't attached to fiber. Those kinds of things can help lower the glucose numbers. In terms of the lipids, one of the things to look at is weight loss can often help bring those numbers down for some people, and changing your diet so that the things that can impact LDL, one of the struggles here, right, is some of the things that benefit diabetes raise LDL for some people. And so that's a counterbalance issue. And I'm trying to walk a midline on that. But if if you're looking at trying not to die of a heart attack, right, not getting heart disease, then you're going to want to prioritize the diabetes over anything else. So the number one risk factor for heart disease is not high LDL, it's diabetes, right? So, but, once if you tackle, you try to tackle as many things as you can, but I would say, if we had a what's the biggest emergency list, the diabetes would trump the LDL from risk analysis issues. All right. Low carb spin would BB, B, and E. You guys have to forgive me, but my brain always goes to breaking and entering when I read that just because of the B and E. Anyway, beef, butter, bacon, and eggs would be good for menopause. Now the questions come in when I threaten you guys I'm leaving. Yeah. So I do think so. Making sure you're getting enough fat and protein in menopause can be very beneficial. It does not give you hormones, right? Menopause is a process that just happens, but studies do show that there is an impact when people are in better metabolic health, when they're eating right, when they're exercising, when they're doing all the right lifestyle things and the right diet things. They do have a reduction in many symptoms of menopause. However, the hormones are still going to be dropping. So I am a big proponent. Dr. Barry is a big proponent of hormone replacement therapy, but hand in hand with that are lifestyle choices that also make you just healthier overall in this transition, an easier one. And certainly beef, butter, bacon, and eggs would be of benefit for the right person. It's not the right diet for me 24/7 because my body thrives on a higher vegetable intake than that. But not everybody is that. So you got to find what's right. Now, menopause is a time when a lot of people have autoimmune flare-ups, right? If they have autoimmune tendencies, autoimmune issues. So beef, butter, bacon, and eggs can be a great elimination diet to figure out what foods affect you and how. So again, whether you use it as a long-term approach or an elimination diet, certainly it's not a negative in that arena of time. But it's not a replacement for hormone replacement. Nothing is but hormones. Tally, what do I think about using peptides besides GLP-1? There are other ones that are being advertised for med spas. They all claim to reduce inflammation. So I'm not big, I will just say it, I'm not big on med spas. I mean, for facials, great. But don't get your medical advice from a med spa is kind of where I am coming from. I know I'm super mainstream old school. Get your medical advice from, I'm laughing because I'm not a person you should be getting your medical advice from. I'm a person that you can be listening to about things to take to somebody to get medical advice from. I'm not saying I am better than a med spa. I am just information. So I'm not saying don't evaluate what's happening at med spa, but I'll just use a GLP-1 comparison issue, right? So I know you're not asking specifically about the GLP-1s. They are a peptide, but So there are companies that make GLP-1s pharmaceutically, right? I think one of them is Eli Lilly and the other one is Novo Nordisk, right? Those are the two main companies. I think they might be the only company. Two main companies making GLP-1s. There are all these med spas that are making compounded versions of these GLP-1s. And when they test these med spas, some of them have the right stuff in them and some of them have none of the stuff in them. So like they've done sort of raids, they've done investigations where they've gone to different med spas, gotten their different compounded versions, and they've said, well, that med spa has too high a dose compared to what they tell you. That med spa, it's too low a dose. And so it's incredibly inconsistent and inconsistent in a way that could hurt people. And so if that's what's happening with med spas and GLP-1s, why do we think that's not also what's happening with med spas and other peptides? So my issue is there's almost no quality oversight on med spas. And because there's no oversight on what they're putting into their vials to give people, is it out of the question that a med spa is doing a great job sourcing things well, doing a really good job? No, that could be absolutely true. But there could be 10 others that are doing a horrible job and putting people's lives in danger. So that's a really, how do you know which one is which? And so that's my concern with going to a med spa that at least hasn't been really thoroughly vetted. Like I want them to have doctors on staff that I trust and to know, so I guess my point is it's just very unregulated. And not that regulation is everything, but we do need to know that what they're advertising, what they're telling you you're getting is actually what you're getting. That's why when I take supplements like vitamins and mineral supplements, I only use companies that are third-party tested, which means there is somebody vetting if they have in them what they're supposed to have in them. I don't just take something off the shelf that I don't know comes from a company that isn't tested, because I am aware that vitamin and mineral companies that aren't tested are terrible. This one has hardly any of it. This one has a lot of it, right? Same thing applies to med spa, but there's no third-party testing for med spas that I am aware of. So, I believe that Dr. Jamie Seaman is attached to, I don't think it's a med spa, but I know she's attached to a clinic where you can get certain treatments you're asking, like NAD+. I might be wrong. I have a memory that she was doing some of those treatments out of a clinic she was working with. Like that's something I'd be like, okay, well, I trust that doctor. And so I trust them to be attached to a good thing. So I would go there, like that one place, right? But I wouldn't go to any of the other hundreds of places, because even if I like the people at the front desk, if I don't know what's behind their scientific stuff, and it's also possible that they get stuff from a supplier and the med spa is all on the up and up, but their supplier is not on the up and up, and the med spa got duped, right? So those are my concerns about med spas. I hope that made sense. So what do I think about NAD might be different than what do I think about NAD from a med spa that I don't know anything about the med spa, right? Those are different. I hear good things about NAD. I don't know enough about NAD to say more than that. Yeah, hopefully that answers that question. All right. All right. Why don't we call it a day? We got some good questions in at the end. Thank you guys for joining. That made it a lot better than me just flapping my gums about hormones. Although I guess peptides are hormones. Yeah. All right, guys. I will be back next week. Bye, everybody.